Hi, this is Dr. Cale Goldfarb with Water and Sports Physical Therapy. I'm here today to talk about lateral epicondylitis, more commonly known as tennis elbow. First of all, tennis elbow, which most people would assume, is pain that's going to be derived or come from the muscles and tendons that attach to a bone right here in your elbow. The key is to make sure you really have a true tennis elbow. You don't have to get it from tennis. You can get it from doing any kind of activity where you're gripping, where you do a strong contraction, grabbing and holding and lifting something, or any kind of throwing activity. If you're a thrower and you throw a ball and you're not used to it, the deceleration or slowing down of your muscles, the muscles here, cause tension on the tendon and on the bone and can cause a tennis elbow or lateral epicondylitis. So we need to make sure you rule out some other things that could cause pain in the elbow. You can see your doctor of physical therapy or a physician to make sure you don't have something else more serious. The first thing could be is your neck. A quick way to rule out a neck problem is to move in full range of motion in all directions. You'd want to side bend, you want to rotate, and especially toward the side of pain, you do what's called a Sperling's test. You bring your head back and compress everything down over here. It might cause local neck pain, but it should not cause any pain to the elbow. These are quick preliminary tests, but if you were to see a specialist, they do much more specific tests. The next thing to make sure is you don't have a problem with a rotator cuff, because commonly rotator cuff issues can cause referred pain down to the elbow. So if you were to see somebody qualified, they'd probably check your rotator cuff, check the resistance of external rotation, internal rotation, and scaption. They'd resist these motions, make sure those don't cause pain in your elbow. And then you'd also look for trigger points. Trigger points are areas in a muscle that refer pain to other areas further away from that muscle. So for example, there could be trigger points in the posterior, the back part of the rotator cuff. When you press on them, they can reproduce pain down to your elbow. If you rule those out, and have somebody professionally rule them out specifically, and you realize it's just a lateral epicondylitis, the pain that you'd have would be with the following. You'd have pain with resistance of wrist extension, you'd have pain with gripping, and you might have pain with stretch. So, the typical straightforward protocol would be to start with gentle stretching. The tissue around this area is sensitive, and if you overstretch it can cause more pain. But this fascial connection, so what you want to do is you want to stretch it gently. The way most people stretch is their hand is open and they pull down like this. This is not an aggressive stretch, and you can make it more aggressive if it feels comfortable by pulling your fingers and making a fist first gently, and then pulling down so you get much more of the soft tissue connection to pull at the origin up here. So you hold that stretch for 30 seconds. You do that 3 times, usually multiple times per day. When you finish that stretch, it should not cause more pain. The next exercise you want to do is you can grab a lightweight or use preferably a band. Wrist extension is an exercise that you do. It should be pain-free. What you want to do is you want to grab a weight, preferably have a band around your wrist so you don't have to make a fist. Gently let the weight hang in your hand. Don't squeeze hard. When you squeeze hard, there's a muscle called the extensor carpi radialis brevis, which is a muscle that attaches up here that causes a lot of this pain. Every time you contract, that contracts further and causes more pain. So don't make a strong contraction. You hold the weight lightly, you let it come down, you pull up, and then let it come down for a rest. Pull up slowly. On the way down, let it relax. Very light and no pain. Very important. You want to avoid your gripping activities, gripping hard things, grabbing things with your palm face down. All of these activities are going to cause more pain and not let this calm down. If it's an acute injury, if it's we're talking about between 0 and up to 14 days, icing is usually a beneficial thing. You can take an ice cube or ice cup, where you take a Dixie cup filled with water, and then when it's frozen, you can put it right directly on the skin. It's probably the most effective way for icing rather than putting an ice pack on there. These are some techniques you can do to help with lateral epicondylitis. or tennis elbow. Any questions, feel free to visit us on the web at waterandsportspt.com or call us at 858-488-3597. Thanks.